Yeah, it really depends on the testing platform where the test goes. So we do some of that internally in labs, and we have turnaround times less than 24 hours on those. Certainly point of care testing, you have results in 15 minutes. And then we're sending tests to our other laboratory partners. Those can take a little bit longer, but in general, the wait times have not been near what they were early in the pandemic. If you remember, very early on, 5, 7 days, 10 days in some places around the country, but we have not had that issue. The labs have been working through that and going as fast as they can. Occasionally an outlier occurs for a reason or a technical reason in the laboratory, but for the most part, the turnaround times have been pretty good. And I would just encourage people to err on the side of caution. Again, if you have symptoms consistent with COVID, sore throat, congestion, fever, headache, it's the middle of a pandemic. Positivity rates are incredibly high. The pretest probability that you have COVID is really, really high because of how much COVID there is. So assume you have it while you're waiting for a test result. It's not a bad idea. I think states ought to consider that as well. Now, I think that the social contract has to be that individuals stay home. You can't say, well, I really don't want to have this and I don't want to know. So I'm just going to, as soon as I feel like I can do things, I'm going to go do them. So I don't think it's a bad approach at all. I mean, again, we have positivity rates north of 40% on tests. Unless you need a test to go back to school or to travel or those kind of things, if you're in a household full of people that had COVID, I don't know that there's any point in going and getting in a long line and then potentially having a test that takes a while to come back. I personally would say, assume you have COVID, stay home. And no matter what the viral illness is or infectious disease, we should have been doing this for many decades, right? If you have influenza, you should stay home. If you have fever of any kind and a cough, you should stay home. And so I don't think we can test our way out of this. And I do agree with you that there are instances where individuals have signs and symptoms consistent with COVID. It's highly likely they have COVID, and having an additional test is not necessarily a useful thing and doesn't add much to the equation. Now, public health officials may not like that answer because they want to know the how wide the pandemic is and where the cases are. But I think at some point there's a diminishing return on going to get tested if you have a high likelihood of having COVID.